Here is the latest legislative news from the Texas Hospital Association, April 17th, 2023. There's no good way to eliminate a business's ability to recoup the lion's share of its costs from the services it performs. Yet still, despite THA's repeated warnings, that's what legislation examined in committee hearings in each of the last 2 weeks would do to outpatient hospital clinics, banning what are colloquially known as facility fees. THA continued its strenuous pushback against a proposed ban on hospital outpatient payments last Thursday when it testified against the latest version of House Bill 1692 by Representative James Frank. The measure would take away the only revenue source paying for patients' care at outpatient clinics, aside from physician service fees. Despite weeks of THA opposition, it remains a bill that would devastate access to care across Texas. If such a ban passes, outpatient clinics all over the state would close. And the committee's substitute for House Bill 1692, which THA General Counsel Steve Woleb opposed in Thursday's hearing of the House Select Committee on Healthcare Reform, adds a troubling wrinkle to the picture. The substitute bill would ban facility fees for preventive services in both inpatient and outpatient settings. By the federal definition of preventive services, that would include numerous procedures including colonoscopies, ultrasounds, mammograms, and many common immunizations. Woleb's testimony emphasized that hospitals wouldn't be able to charge for the cost of nurse staffing, equipment, and supplies for these services, among other expenses. Also testifying against the bill was Frank Beeman, CEO of Faith Community Health System, noting the challenges it would represent in rural communities and the danger it poses to access to healthcare. THA is continuing to closely monitor the progress of these bills and working diligently to stop them. In a significant step forward for THA's behavioral health agenda this session, a bill that would require Medicaid coverage for partial hospitalization and intensive outpatient therapy services was voted out of committee. House Bill 2337 by Representative Tom Oliverson earned a favorable report from the House Committee on Human Services last Tuesday. Partial hospitalization and intensive outpatient therapy allow patients to split their time between receiving psychiatric care in a facility and spending time at home. The bill passed out of committee a week after Chris Bryan, Vice President of IT and Public Policy for Clarity Child Guidance Center in San Antonio, testified for THA in support of it. After helping that measure get to the next level, Bryan returned to the Capitol this week to register THA's support for a bill establishing a grant program for behavioral health hospitals to boost their health information technology capabilities. Senate Bill 1903 by Senator Jose Menendez would help behavioral health facilities catch up to physical hospitals in the areas of electronic health record keeping and management. During her testimony to the Senate Committee on Health and Human Services, Bryan emphasized that behavioral health hospitals are far behind the curve in that area. THA also supported a grant program to address nursing faculty shortages, with Assistant General Counsel Heather De La Garza's testimony Thursday on Senate Bill 2059 in the Senate Subcommittee on Higher Education. The bill by Senator Juan Chuy Hinojosa would establish grant programs to install nurse preceptors at clinical sites, as well as fund pilot programs and part-time faculty nurses. Other THA testimonies this week sought to protect hospitals from two of their most common sources of aggravation: onerous and unworkable burdens and government rate setting. Senate Bill 1193 by Senator Charles Schwertner would mandate that all hospitals have at least one physician present at all times and give patients in all hospitals the right to request that a physician perform all of the patient's healthcare services. Woleb opposed the bill for THA in the Senate Health and Human Services Committee, noting that it would undermine existing law that provides flexibility for rural hospitals in areas with a physician shortage. De La Garza represented hospitals against House Bill 5186 by Representative Greg Bonin, which, as filed, would pave the way for the state budget to cap payment rates for treating those insured in the state's employee and teacher retirement systems, as well as the University of Texas and Texas A&M systems. De La Garza said the bill would represent a significant step backward, and that if providers are paid less, it doesn't lower the cost to provide health care. Join us again next week for more updates from the 2023 session of the Texas Legislature.